Hello, everyone. Thanks for joining us. Let's begin with health matters. Nigeria has recorded 145 deaths from Lassa fever as of epidemiological week 25, with a case fatality rate of 18.6%. The Nigeria Center for Disease Control and Prevention disclosed this in its latest report via its official website. The NCDC said this marks an increase from 17.6% reported for the same period in 2024. The report, which covered the week of June the 16th to 22nd, revealed that 781 confirmed cases have been reported out of 5,943 suspected cases across 20 states and 101 local government areas. In the current reporting week, 10 newly confirmed cases were reported in Ondo and Edo states. That's a slight increase from the 8 cases recorded the previous week. According to NCDC, 91% of all confirmed cases so far this year were reported from just 5 states. That's Ondo, reporting 31%, Bauchi reported 24%, Edo 17%, Taraba 16%, and Ebonyi 3%. It also said the disease continues to affect young adults predominantly, with the 21 to 30 age group most impacted. The Nigerian Public Health Agency said that despite a decline in the overall number of suspected and confirmed cases compared to 2024, the rise in case fatality rate is raising concerns among health experts. Now, for more on this development, Professor of Virology, Professor Oyewale Tomori, joins me on the news. Good to have you join us, Prof.
Thank you. Good evening. How are you doing?
I'm very well, but this report is quite concerning, Prof. And I want us also to look at some of the key highlights. We see a rise in case fatality rate from the previous year, and that must be concerning for you as well, because one would imagine that we should be getting better at handling this.
You are right. I mean, this is most worrying, but there are many, many factors that could be responsible. People are not reporting on time to the hospital. They're coming in when in the very late stage of their disease, or they're not reporting at all. And I think that's part of the problem. With the current situation, economic situation, people will probably won't want to come to the hospital on time until it's almost too late. And that's why we're getting these higher case fatality rates that we're getting.
And Prof, are we doing enough? Because some diseases present the same symptoms. For example, COVID, malaria, typhoid, and even Lassa. Are we doing enough, as for example, the health agency? Are they doing enough to highlight the differences and the urgency of reporting to the hospital and not buying drugs from over the counter?
No, we're not doing well at all. I'm sorry to say. Lassa fever has been with us since 1969, and we're still talking about case fatality rate of almost 20%. If you look at the figures, I mean, the figures you have now, they tell you it's less than last year, but the year is not ended yet. So we don't know what's going to happen between now and the end of December. So it's really worrying, and I think we need to do more. I think part of the problem is the fact that we need to decentralize these public health issues. States are not doing enough. Everybody is waiting for NCDC to do it. That wasn't what used to be in those days. Each state dealt with its own public health and only got assistance from NCDC. Today, they have abandoned all that, and NCDC is running. You go and do their report. They are sending out teams into different parts of the country. That shouldn't be the case. It's that they should be there to just help the state. The states are the ones that are having the problem. The cases are occurring in the local government. They are occurring in the states, not in Abuja. So we need to get back to our state governors and the local government to get down and get their work, to do their work properly.
And it's interesting you mentioned the states, Prof, because from this report, we see that 91% of all confirmed cases this year were reported in just 5 states, and that's Ondo, Bauchi, Edo, Taraba, and Ebonyi. These states are all mostly in different regions, with the exception of Taraba and Borno. So what is responsible for this? And then what more can be done if we want to, bring down the case fatality rate as well?
Yes, we know the Lassa fever endemic zones of Nigeria. In fact, I'm quite surprised that Bauchi has come in. It used to be Edo, and Ondo states that used to give us a large number, and Mboyi also. But the incursion of Bauchi and Taraba gives us more concern. And I think those state governments need to do something about that one. Like I mentioned, the great country or the states that used to cause us more problem was either Edo and Ondo, and maybe one or two others in Ebonyi. But now it's Bauchi is coming in, Taraba is coming in. Who knows what more states are coming in?
And, I think also worrying, Prof, is the fact that this now also affects predominantly young adults. Hopefully that becomes, the targeted population in terms of awareness. Thank you so much for your time, Professor Tobori, Professor of Virology.
It's my pleasure.